Lung cancer. Lung cancer occurs when cells in the lung mutate and grow uncontrollably, forming tumors. It's primarily caused by smoking, but can also develop in non-smokers due to factors like exposure to secondhand smoke, radon, or other environmental pollutants. Pancreatic cancer. Pancreatic cancer starts in the tissues of the pancreas, an organ that lies horizontally behind the lower part of the stomach. It's often diagnosed at an advanced stage because symptoms may not appear until the cancer has spread. Liver cancer. Liver cancer forms in the tissues of the liver and is often a result of chronic liver damage, such as from hepatitis B or C infection, cirrhosis, or excessive alcohol consumption. It can be difficult to treat, especially if not caught early. Colorectal cancer. Colorectal cancer affects the colon or rectum and usually develops from precancerous polyps. Risk factors include age, family history, inflammatory bowel disease, diet, and lifestyle factors. Screening tests like colonoscopy can detect and prevent this cancer. Brain cancer. Brain cancer originates in the brain or nearby structures and can be primary starting in the brain or secondary metastasized from other parts of the body. Symptoms vary depending on the location and size of the tumor and may include headaches, seizures, or neurological deficits. Ovarian cancer. Ovarian cancer starts in the ovaries, which are part of the female reproductive system. It's often diagnosed at an advanced stage because early symptoms are vague and easily mistaken for other conditions. Risk factors include age, genetics, and hormonal factors. Esophageal cancer. Esophageal cancer begins in the esophagus, the muscular tube that carries food and liquids from the mouth to the stomach. It's often diagnosed at an advanced stage due to late-onset symptoms like difficulty swallowing, weight loss, or chest pain. Bladder cancer. Bladder cancer forms in the lining of the bladder and is often characterized by blood in the urine, frequent urination, or pain during urination. Risk factors include smoking, exposure to certain chemicals, chronic bladder inflammation, and genetics. Stomach cancer. Stomach cancer, also known as gastric cancer, develops in the lining of the stomach. It's more common in older adults and often diagnosed at an advanced stage due to nonspecific symptoms like abdominal pain, nausea, or unintentional weight loss. Kidney cancer. Kidney cancer starts in the kidneys, which are responsible for filtering waste products from the blood to form urine. It's often diagnosed at an early stage and may not cause symptoms initially. Risk factors include smoking, obesity, high blood pressure, and certain genetic conditions. Thyroid cancer. Thyroid cancer begins in the thyroid gland, a butterfly-shaped organ in the front of the neck that produces hormones. It's often detected early and has a high survival rate, especially when treated promptly. Risk factors include radiation exposure and certain genetic syndromes. Leukemia. Leukemia is a type of blood cancer that affects the bone marrow and blood cells. It's characterized by the rapid production of abnormal white blood cells, which crowd out healthy blood cells. Symptoms may include fatigue, weakness, frequent infections, and easy bruising or bleeding. Melanoma. Melanoma is a type of skin cancer that develops from melanocytes, the cells that produce pigment in the skin. It's often caused by exposure to ultraviolet radiation from sunlight or tanning beds. Melanoma can be aggressive and spread to other parts of the body if not treated early. Non-Hodgkin lymphoma. Non-Hodgkin lymphoma is a cancer that originates in the lymphatic system, which is part of the body's immune system. It involves abnormal growth of lymphocytes, a type of white blood cell. Non-Hodgkin lymphoma can occur in various parts of the body and may spread to other organs. Hodgkin lymphoma. Hodgkin lymphoma is a type of lymphoma characterized by the presence of Reed-Sternberg cells, large abnormal cells found in the lymph nodes. It typically starts in the lymph nodes in the neck or chest and may spread to other lymph nodes and organs. Prostate cancer. Prostate cancer develops in the prostate gland, a small walnut-shaped gland in men that produces seminal fluid. It's one of the most common cancers in men and usually grows slowly. Risk factors include age, family history, and certain genetic factors. Breast cancer. Breast cancer forms in the cells of the breast and is the most common cancer among women worldwide. It can occur in both men and women, but is much more common in women. Risk factors include age, family history, genetic mutations, and hormonal factors. Cervical cancer. Cervical cancer originates in the cells lining the cervix, the lower part of the uterus that connects to the vagina. It's often caused by persistent infection with high-risk strains of human papillomavirus. Regular screening with Pap tests and HPV tests can help detect cervical cancer early. Testicular cancer. Testicular cancer starts in the testicles, the male reproductive glands that produce sperm and testosterone. It's relatively rare compared to other types of cancer, but is the most common cancer in young men aged 15 to 35. Testicular self-exams and early medical evaluation are important for early detection. Bone cancer. Bone cancer begins in the bones and can arise from bone cells or from other types of cells that have spread to the bones. Primary bone cancer is rare, while secondary bone cancer, which starts elsewhere in the body and spreads to the bones, is more common. Uterine cancer. Uterine cancer, also known as endometrial cancer, develops in the lining of the uterus. It's more common in postmenopausal women and often presents with abnormal vaginal bleeding. Obesity, hormonal factors, and certain medical conditions are risk factors for uterine cancer. Gallbladder cancer. Gallbladder cancer forms in the tissues of the gallbladder, a small organ beneath the liver that stores bile. It's rare and often diagnosed at an advanced stage due to nonspecific symptoms like abdominal pain, jaundice, or unexplained weight loss. Oral cancer. Oral cancer includes cancers of the lips, tongue, gums, floor of the mouth, and other oral cavity structures. It's often linked to tobacco use, excessive alcohol consumption, and infection with human papillomavirus. Early detection through regular dental checkups is crucial for better outcomes. Sarcoma. Sarcoma is a type of cancer that originates in the soft tissues such as muscles, tendons, fat, blood vessels, and nerves, or in the bones. There are many subtypes of sarcoma, and treatment depends on the specific type and stage of the cancer. Skin cancer. Skin cancer includes several types, such as basal cell carcinoma, squamous cell carcinoma, and melanoma. It develops in the skin cells and is often caused by exposure to UV radiation from sunlight or tanning beds. Early detection and treatment are important for preventing the spread of skin cancer. Mesothelioma. Mesothelioma is a rare cancer that affects the mesothelium, the thin layer of tissue that covers most internal organs. It's usually caused by exposure to asbestos fibers and commonly affects the lining of the lungs or the abdomen. Multiple myeloma. Multiple myeloma is a cancer that develops in plasma cells, a type of white blood cell found in the bone marrow. It can weaken the bones and immune system, leading to symptoms like bone pain, fractures, anemia, and susceptibility to infections. Anal cancer. Anal cancer forms in the tissues of the anus, which is the opening at the end of the digestive tract. Risk factors include infection with human papillomavirus, anal intercourse, smoking, and a weakened immune system. Penile cancer. Penile cancer starts in the tissues of the penis and is relatively rare. It's often linked to infection with HPV, poor hygiene, smoking, and chronic inflammation of the foreskin. Vulvar cancer. Vulvar cancer develops in the tissues of the vulva, which is the external genitalia of women. It's most common in older women and often presents with symptoms like itching, pain, or a lump or sore on the vulva. Laryngeal cancer. Laryngeal cancer originates in the tissues of the larynx, or voice box. It's often associated with smoking and excessive alcohol consumption. Symptoms may include hoarseness, difficulty swallowing, or a persistent sore throat. Nasopharyngeal cancer. Nasopharyngeal cancer starts in the nasopharynx, the upper part of the throat behind the nose. It's more common in certain populations, such as people of Asian descent. Risk factors include infection with the Epstein-Barr virus, family history, and exposure to certain chemicals. Adrenal cancer. Adrenal cancer begins in the adrenal glands, which are located on top of the kidneys and produce hormones like cortisol and adrenaline. It's rare and often aggressive, with symptoms depending on which hormones are affected. Gastrointestinal stromal tumor. GIST is a type of tumor that forms in the gastrointestinal tract, most commonly in the stomach or small intestine. It arises from specialized cells called interstitial cells of Kajal. Treatment may involve surgery, targeted therapy, or chemotherapy. Retinoblastoma. Retinoblastoma is a rare cancer of the eye that usually affects young children. It develops in the retina, the light-sensitive tissue at the back of the eye. Symptoms may include a white glow in the pupil, crossed eyes, or vision problems. Thymoma. Thymoma is a tumor that originates in the thymus gland, a small organ located in the chest behind the breastbone. It's often associated with autoimmune disorders like myasthenia gravis. Treatment usually involves surgery, radiation therapy, or chemotherapy. Cholangiocarcinoma. Cholangiocarcinoma begins in the bile ducts, which are tubes that carry bile from the liver to the small intestine. It's often diagnosed at an advanced stage and can be difficult to treat. Risk factors include primary sclerosing cholangitis, liver fluke infection, and certain liver conditions. Merkel cell carcinoma. Merkel cell carcinoma is a rare and aggressive skin cancer that usually appears as a painless, firm lump on the skin. It's often found on sun-exposed areas and may metastasize to other parts of the body. Peritoneal Cancer. Peritoneal cancer develops in the peritoneum, the thin layer of tissue that lines the abdomen and covers the abdominal organs. It's often associated with other types of cancer that have spread to the peritoneum. Soft tissue sarcoma. Soft tissue sarcoma is a cancer that forms in the soft tissues of the body, such as muscles, fat, nerves, or blood vessels. It can occur anywhere in the body and may present as a painless lump or swelling. Treatment usually involves surgery, radiation therapy, and chemotherapy. If you have concerns about your health or symptoms that persist, it's important to consult with a healthcare professional for proper evaluation and management. Stay informed, prioritize prevention, and seek support when needed. Together, we can continue to raise awareness, support research, and strive for better outcomes in the fight against cancer. Don't forget to like, subscribe, and share your thoughts in the comments below. Until next time.